you can get sober while working on your traumas. It can happen. It's not something that I suggest, or I personally, as a therapist, would want to dive in when a client is a week sober, because their emotions are going, they may be going through post-acute withdrawals. Like, you don't know what's going on. I won't ever tell them like, no, we can't talk about that, because I want to be upfront and like full disclosure with them. Like, you can talk about anything. And I explain to them, you know, we may not talk about this stuff because of this, but I tell them if anything's ever bothering you, et cetera, please talk about it. But to answer your question, yes, I do believe someone can get sober while going, like, healing through their traumas. I suggest let's get them sober first and then kind of go from there, if that makes sense. Did I answer the question?
So you get them sober without having to work on the trauma in the beginning, just in the initial phase?
Technically, yes. I'm not saying we can't or we don't have to touch on trauma, but initially I would like to see the client have stability first in their recovery.
Yeah, I think, and I spent some time, you know, working in that setting as well. I actually think it's inadvisable to start digging into the trauma too quickly, for a couple reasons. One, just from so we'll get all internal knowledge here. Maslow's hierarchy of needs, right? So to try to take it into a different format, Ian, like if people are working with you and you are hungry, right? You're just starving, right? And it's made you cranky, and everybody likes to talk about hangry now and stuff like that. But your parents or a friend wants to sit down with you and talk about new behaviors or gaining understanding and insight into what you're going on, and your stomach's growling and your head's kind of screwed up and your blood sugar's all over the place. Like, you're just not going to be in a place to have a productive conversation in that moment, because one of your baseline needs has not been met, right? So Maslow's hierarchy of needs says it's like a pyramid. You've got to have a strong foundation before you start working yourself up to insight and enlightenment, which is at the top of the pyramid, right? So being physically separated from your drug of choice is one of the primary benefits of rehab, because you're not getting that poison in, you're not disrupting your mood state, you're not resetting yourself all the time. And so then if you start introducing trauma work or processing around abuse and things like that into that volatile system before you have that good foundation, you know, listen, you know, one of the things that you don't cause much of anything, but you're likely to cause a relapse more than you are to cause a breakthrough if you start getting in there on day 3 and go, hey, you're still working the remnants of this fentanyl out of your system, but I really want to talk about how dad used to hit you all the time, and now your emotions are through the roof, right? And as an addict, what's the easiest way to change how you feel? Go use, right? I've got no other coping skills in place. I've got no foundation. So it's an interesting concept in therapy of pacing. You don't want to go too far too fast, or timing in terms of when to introduce some of this work. So
you could do more harm than good.
That's it. That's right.
Yeah.
Those are the two things.
I think I just mistaked full recovery for just physically being separated from the substance or the behavior.
Yeah.
So that's what happened there.
Well, no, but it's not a mistake, right? So I think we wrestle with that as practitioners, right? So I would kind of pose that back to Brittany. If somebody never uses again, but they are not dealing with their traumas, have they recovered? What's your opinion on that?
I guess it depends on what they're going through, what their behaviors are. You know, if it's distinct, like they're really struggling and it's because of X, Y, and Z, then no. But if for some reason you're having a great life and you've never went to therapy, then by all means, I am so happy for you. But that's not usually the case.
Right. That's right. And so that's also when it opens the door to process addictions, and you know, basically addiction can change forms. And yeah, I haven't touched a drug in 20 years, but you know, I'm getting into fights. My relationships are crap. I have a gambling problem, and I'm addicted to sex, but I'm recovered because I didn't touch heroin ever.
But I'm great because I have not used heroin in 20 years.
That's exactly right. So you're right, Ian, to draw that line between sort of like initial and full recovery. I think the goal is always to push that next level, but the initial goal is let's get you stopped and let's get you healthy, right? Let's get you hydrated and eating well and sleeping well. And yeah.